Could a hidden virus be damaging your liver without you even knowing?
Hepatitis B is a serious viral infection caused by the hepatitis B virus, also known as HBV, which specifically attacks the liver. It is one of the most widespread infectious diseases in the world and a major global health problem. According to the World Health Organization, over 250 million people worldwide are living with chronic hepatitis B, and more than 800,000 people die every year due to complications related to the disease. These complications are usually advanced liver failure, liver cirrhosis, or liver cancer. Unlike some other infections, hepatitis B cannot be completely cured with today's medicine, but it can be effectively prevented and controlled with modern treatments and vaccines. Hepatitis B spreads through blood and other body fluids, but it is important to know that it does not spread through casual, everyday contact, such as hugging, shaking hands, sharing food, or simply breathing the same air. The main ways the virus spreads are through direct blood-to-blood contact, through unprotected sexual contact from mother to child at birth, and through unsafe medical or cosmetic procedures. For example, using contaminated needles, syringes, or surgical instruments is a major source of transmission. Tattooing and body piercing done in unsterile conditions can also transmit the virus. Even sharing personal hygiene tools like razors, nail clippers, or toothbrushes with someone who carries the virus can be dangerous, because tiny traces of blood invisible to the naked eye may still carry HBV. The virus is highly resilient and can survive outside the human body for up to a week while still being able to cause infection. After infection, many people may not notice any symptoms at all for months. This silent phase is very dangerous because the virus is damaging the liver without the person realizing it. When symptoms do appear, they can include fatigue, weakness, loss of appetite, nausea, vomiting, abdominal discomfort, pain under the right rib cage where the liver is located, dark urine, pale or clay-colored stools, and yellowing of the skin and eyes, a condition called jaundice. These symptoms can be mistaken for flu or digestive issues, which often delays diagnosis. In some people, the infection clears up naturally within 6 months, but in many others, especially if infected at a young age, the virus remains in the body permanently and becomes chronic. Chronic hepatitis B is the real danger because it keeps silently damaging the liver for years or even decades. If left untreated, chronic hepatitis B can lead to cirrhosis, which means the healthy tissue of the liver is replaced by scar tissue, reducing the liver's ability to function. Once cirrhosis develops, complications like internal bleeding, fluid buildup in the abdomen, severe infections, and liver failure may follow. Hepatitis B is also one of the strongest risk factors for developing hepatocellular carcinoma, a deadly type of liver cancer. In fact, people with chronic hepatitis B have up to 100 times greater risk of developing liver cancer compared to people without the infection. The question most people ask is hepatitis B curable? The answer is no, there is currently no complete cure. However, there are highly effective treatments that suppress the virus, reduce its activity, and protect the liver from further damage. The most commonly used antiviral medications are tenofovir and entecavir. These drugs do not eliminate the virus entirely, but they can stop it from multiplying and lower the amount of virus in the blood to very low levels, sometimes undetectable. This helps prevent cirrhosis and liver cancer, and in many cases, people with hepatitis B who receive proper treatment can live long and healthy lives. Treatment is usually long-term and requires regular checkups, because stopping the medication too early can allow the virus to reactivate.
Is hepatitis B really incurable, or can it be controlled for life?
Another important aspect of management is lifestyle. People living with hepatitis B must avoid alcohol completely because alcohol accelerates liver damage. A healthy diet rich in fruits, vegetables, lean proteins, and whole grains is recommended, along with avoiding unnecessary medications or herbal supplements that may stress the liver. Regular monitoring is essential. Patients often need blood tests to check viral load and liver function, as well as imaging studies like ultrasound to detect early signs of liver damage or cancer. The most powerful tool against hepatitis B, however, is prevention. There is a safe and effective vaccine that provides long-lasting protection. The hepatitis B vaccine is over 95% effective in preventing infection and is part of the routine childhood immunization schedule in most countries. Newborns usually receive the first dose within 24 hours after birth, followed by 2 or 3 more doses to ensure full protection. Adults who are not vaccinated can also get the vaccine at any age, and it is especially important for healthcare workers, people with multiple sexual partners, people who inject drugs, and those traveling to areas where the virus is common. Apart from vaccination, prevention also includes safe sex practices such as using condoms, ensuring that all medical and dental equipment is properly sterilized, avoiding shared needles, and choosing only professional and reputable facilities for tattoos and piercings. Even small preventive measures, like never sharing razors or toothbrushes, can reduce the risk of infection. One common misconception is that hepatitis B is only a disease of people who use drugs or engage in risky sexual behavior. This is not true. Anyone can be infected, regardless of lifestyle, because the virus can spread in many ways. Another myth is that people with hepatitis B cannot live normal lives. In reality, with modern medicine, regular monitoring, and a healthy lifestyle, most patients can live just as long as people without the virus. A particularly important issue is mother-to-child transmission. If a pregnant woman has hepatitis B, the virus can pass to the newborn during delivery. But there is good news. This risk can be greatly reduced if the baby receives both the hepatitis B vaccine and an injection of hepatitis B immune globulin within the first 12 hours of life. This combined approach is more than 90% effective in preventing infection in newborns. For this reason, many countries have mandatory screening for pregnant women. Researchers are actively working on finding a complete cure for hepatitis B. Several experimental treatments are in development, aiming not only to suppress the virus but to completely eliminate it from the body. These include drugs that directly target viral proteins, therapies that boost the immune system's ability to clear the virus, and even gene editing techniques like CRISPR. While these approaches are still being studied, they give hope that one day a true cure will be available. Until then, prevention through vaccination and proper management of existing infections remain the most effective strategies. To summarize, hepatitis B is a common, highly infectious, and potentially life-threatening disease that damages the liver. It spreads mainly through blood and body fluids. It often shows no symptoms in the early stages, and it can silently progress to cirrhosis or liver cancer. There is no complete cure yet, but antiviral treatments, healthy lifestyle choices, and regular medical monitoring can control the disease and prevent severe complications. The most powerful weapon against hepatitis B is the vaccine, which is safe, highly effective, and widely available. By raising awareness, encouraging vaccination, and supporting those living with the disease, we can significantly reduce the global burden of hepatitis B and save millions of lives.